Hi everybody, I'm Rick Arman for DailyDodge.com. Today visiting with Drs. Tom Castillo and Dr. J. Wilkins of Vita Park Eye Associates. I am one of the many thousands or millions of people that had cataracts and went through a surgery with Dr. J here at Vita Park Eye Associates several years ago, and I never expected to have the success with my vision that I've seen, Dr. J. Let's talk about implants, because a lot has changed over 10 years, 20 years, 50 years.
Yeah, so nowadays the implants that we have in the eye can be almost customized to the person depending on what they're looking for. In the olden days, we used to just take out the cataract and we put in the best implant that we had at the time, which didn't correct for much. It corrected for nearsightedness and farsightedness. Nowadays, we have implants that'll correct for astigmatism. We'll have implants that can correct for the need for reading glasses. So depending on how a person wants to affect their lifestyle and how much they really don't like wearing glasses, we have options nowadays. They're not all covered fully by Medicare, but oftentimes the cost of the implants are money well spent.
Well, I can say firsthand that my vision is the best I've ever had my entire life, going back to before I even had glasses at 4 years old. Dr. Tom, the procedure itself, how long does it take to have implants put in, and how easy is it on the patient?
The procedure itself only takes maybe about 20 minutes to go ahead and have the cataract removed and have the implants put in. The patients are usually there just maybe a few hours because there's preparation, checking the blood pressures and checking all the vital signs, making sure that the patient is prepped and put into a sterile environment so that we can have a good outcome. And then afterwards, they just grab a little bite to eat and head on home.
Simple. Dr. J, what about the actual procedure itself? What can people expect to experience? Are they going to be awake during this?
Yeah, usually people are sedated and very comfortable, but they're not completely asleep. And the main thing that people ask about, they ask, how am I supposed to keep my eye open during this? There's an instrument that'll help hold it open, so you don't have to worry about blinking. They worry about what they're going to see. They're always worried, am I going to see it coming at me with instruments? And once the eye gets numbed up, it really doesn't see very much. Sometimes people will see these little swirly colors, and they describe them as almost like the northern lights, which I'm told are very pretty.
Yes.
And that lasts for just 10-15 minutes or so. And then they ask me, what am I going to feel? Am I going to feel anything sharp? It's kind of like when you go to the dentist and everything gets all numbed up. You can kind of tell he's working on you, touching by your nose and your cheek, but nothing that hurts. Sometimes a person will feel like a little water on their face too as we take out the cataract, but very comfortable.
What about recovery? Are we looking at how much time before the eye's healed?
So the eye heals up actually very quickly compared to, like, if you had a knee surgery done or a heart surgery. Usually about a week or so is what we expect for most people to heal up well. And then we check the glasses prescription to see if that's changed. A lot of times it has. Usually about 3 to 4 weeks after the surgery.
All I can say is that my surgery was beyond successful, because not only do I see great during the day, but my nighttime vision is through the roof. So thank you for that.
You're welcome.
That's going to wrap up this edition, and thank you so much, everybody. If you want more information about cataract surgery and implants, come and see the great staff here at Vita Park Eye Associates in Beaver Dam.